Hi, I'm Alex.
And I'm Bonnie.
And together we're going to be presenting PaRx, the evidence-based nature prescription that belongs in your pain practice. And we have no disclosures to make. So our objectives for today are to learn the physiological and emotional benefits of nature, increase the effectiveness of our nature prescriptions with an evidence-based strategies, and to also explore the strategies for prescribing nature and a free Canada PaRx Pass on the RX program, the PaRx program, and also hear from a patient. But we're going to listen to those objectives with some nature. Nature, profoundly beautiful, but also profoundly powerful. Being immersed in nature has the ability to decrease our blood pressure, reduce pain, improve immune function, and cognition. It has so many amazing physiological effects that we can use to help our patients. Today, we're going to learn more about that. How nature helps us, how much you need, how to prescribe it, and how to access a free PaRx Canada Pass, which is what you need to come to this beautiful national park. So why nature? That's exactly why nature, because simply being in nature has powerful effects. Pain is a powerful beast. We all know that, or we wouldn't be here, but so is nature. So nature's benefits. There's the link here for the PaRx program, but nature's benefits: pain reduction, decreased anxiety, increased energy, reduced stress levels, improved heart health, longer life, reduced fatigue, something we can all use, and reduced dementia risk. So is it only in Canada that nature is effective? Clearly not. So the Walk with the Doc program actually started in 2005 in the US, and it was started by a cardiologist because of all the cardiac positive effects of nature. PaRx is a US-based program which was launched almost 10 years ago in 2013. Scotland also has a nature program that was started in 2017. And also the National Health Service, which is Britain, has a referral program with nature-based activities. So it's really worldwide, the effects of nature in a positive way. So we always learn so much from patients. We thought it would be really interesting to get the patient's perspective of whether nature is helpful for pain. And this particular patient just happens to be my daughter.
Hi everyone, my name is Cassandra, and I'm a chronic pain patient that utilizes nature. I am sorry that I'm not outside filming this, but it is incredibly windy in Edmonton today, and you would not be able to hear me at all. You would just hear the gust of the wind. So I guess that is part of nature. Mother Nature has their own plan for us. But I'm going to be telling you a little bit about nature, what I've done, and how it's helped me a lot recently. I'm going to start you off at the beginning. 12-year-old me suffering from chronic pain, not really wanting to do much exercise, so I know it was a technique. I really did not want to do it, but my mom had said, let's go outside and go for a run. And as much as I hated the exercise to start, which you wouldn't believe it now looking at me, but I did, nature was something that I really enjoyed. So whether that was going out for a run, going for a walk, just doing different activities outside, I found really gave me a sense of calmness. It helped my fatigue I was suffering from, any anxiety that was associated, and it gave me a way to disconnect from my everyday life, whether that was school or work or friends and the illness itself. And it gave me the ability to also exercise and work out and do different activities that helped me improve my health, helped me manage my condition, and be happier overall. So, getting out anywhere from 2 to 3 times a week has been instrumental in my life. I try to do it every day, even if it's just for 10 minutes to go outside in the sunshine or go outside in general. But it is something that I cannot thank enough because it has become so important in managing my condition.
So what does nature do if you have chronic pain that affects every single dimension of your life? that it feels like a burden. Does it still work for you?
Being in pain is a burden. Anyone can tell you that. But what few understand is just how great that burden can be when pain is chronic. It becomes not only a physical burden, but a mental and emotional one as well. It's not a burden that we should let stop us, though. That doesn't mean it's easy to just carry on. But important things are rarely easy. One of the things that I find that helps me carry on and sort of lightens the burden of the pain is going out into nature. When I'm in nature and I'm looking around at the beautiful trees and feeling the sun on my skin and hearing the birds chirp and seeing the beautiful water if there's some, or the green grass, or even the beautiful blanket of snow that's just fallen, my mental and emotional burden is lightened just a little bit. It's supported a little bit by that beauty of the moment, and it really helps me get through that day. It helps ground me in the moment and helps me just feel better. So if anyone is struggling right now with their burden and it's dragging you down a little bit, I really suggest heading into nature to see if it helps lift your spirits, as it does mine and it does with so many others.
So we've heard that nature can help you with episodic pain, with chronic debilitating pain. But does it help as we age? Because these were two young people. So what happens if you're older? What happens if you're 90? What happens if you're 90 and you're not as nimble as you used to be? Yes, nature still has significant benefits. So nature can help you relish life, reduce pain, and reduce the burden of chronic disease even when you're in your 90s. But what happens if your back looks like this? What happens if you have this wildly curved back and you're full of arthritis and you've got total hips and really you are, your x-ray is less than optimistic? Can nature help? Watch this. This is my mom with that back, with those hips. Watch what she's doing, kicking the sand to get the water to squirt out. She's having fun, even at age 90, with that back and those hips. So what if you have a brutal non-healing fracture, an arm that basically has an extra joint in it that's not meant to be there? Can you still enjoy nature? Can it still help reduce your pain?
Okay, we're going up in the air.
This is my mom on the
That's
seesaw she
awesome.
discovered.
Perfect.
She discovered this wonderful seesaw when she was out in nature that made her feel wonderful and made her feel that she relished life. So nature can help us whether we're young, whether we're old, and it's free, but not everybody can access it. So I'm going to hand it over to Bonnie, who's going to teach us about how to access a free PaRx pass for those patients that are appropriate and how to prescribe it and how to do it in the best possible evidence-based way. So I'm going to hand it over to Bonnie. Thank you.
Thank you. So now I will show you around the PaRx prescription website. It's a resource that will help you become a more effective nature prescriber, and it's a resource your patients can explore on their own. I've been prescribing nature in a more systematic way for about 5 months. Each prescriber can prescribe 1 Canada PaRx pass per month, so you do have to prioritize based on need and who is likely to make use of it. More prescribers, like you guys, will mean more access for people who would benefit from nature. So consider signing up. It's easy to do. So we'll go to the About page. So on this page, just to describe, the website scrolls down and then it has those tabs at the top. I'm just sharing some screen captures just to give you an idea of the resources. I think if I were scrolling around, it's just hard to do that in a presentation. So tells a little bit about the beginning. And then this one is guidelines for everyone on how to include nature, how much time you need, and how to make it a habit. So the guidelines they give based on evidence are that at least 2 hours a week and 20 minutes at a time. Obviously more is better, but some people can only manage a little bit. And so that gives you an idea of what's going to make a difference. And then lots of ways of kind of putting in a little more green into your routine, putting it into your schedule, involving others, and then also respect nature. And then the next one is the page for prescribers. So it helps you to understand why you would do this, and goes on to describe how you can make it more likely that your patients will follow through. And that's where we start to get into the art of prescribing nature. So here are a few of the tips. Give them the specific amount of time. And what counts as nature time is pretty vast, but it comes down to what's meaningful contact. And for some people, they might just be in their garden, or some will want to be hiking, but it's making it patient-centered and self-directed. And then who can participate in this? Any licensed healthcare provider, nurses, physicians, physiotherapists, occupational therapists, and others. All of those can prescribe nature through this program. Now, some tips to make it more effective. Try to make it the fourth pillar of health, or however many pillars you're working with. But if you're talking about diet, exercise, and sleep, then add nature time. So it just fits right in with all the other good advice that we might be giving. But we're always just trying to make it as close a fit to the individual client as you can. So personalize it. If you know where the person is from, their address, or the town they live in, try to do a little research so you really understand what's walkable, bikeable, or easy to access near them. And a few other suggestions there. Third one, schedule it. Just like a doctor's appointment or a coffee date, people are more likely to stick to a commitment when they've written it down. And then follow up. So check in on your patient's progress the next appointment after you've prescribed it. And then we also find that patients who see and hear evidence about their healthcare providers getting out in nature themselves, or getting active, they're going to be kind of motivated by that and more likely to change their behaviors. And so there are quite a few evidence-based patient handouts, which puts a lot of the information that's in the website if you've explored, but it puts it in one place. So really easy when you're making a prescription for somebody to just throw in a handout that fits their condition as closely as possible. So I've got a couple examples. There's the general adult health, and I know it's too small to see in this presentation, but here it is. It's got all the key points and makes it really easy. So even though you may have talked with your client about what this is, the handout just really reinforces that, and it would help them to explain to someone else. And just for another example, we've got the child or kids mental health prescription, and this is one that it's kind of geared towards giving to a parent, unless the child was a little bit older, but it kind of talks about same things, trying to improve your mental health through being in nature, and encouraging, actually being in nature, being around trees makes people kinder, which is nice. You know, maybe we all need a little bit of that. And so lots of great advice. And again, I know it's a bit too small, but I'm just letting you know what's in this resource and how you can use it. And a little bit more about nature's power and PaRx prescription. So nature helps control blood pressure, drops your blood sugar, supercharges the effect of exercise, just as Cassandra said. It helps reduce pain, makes you feel younger, reduces the risk of dementia, it boosts the immune system, and it reduces risk of chronic diseases like asthma, diabetes, heart disease, hypertension, and stroke. And this is one of the trails in my neighborhood, right in the middle of Edmonton. No, sorry, go on to the next one. And so this is the page. There's along the top, there's a little box that says log your PaRx or PaRx prescription. So that's what it looks like. So if you are a prescriber, you'd put in that you're a prescriber, you put in your own unique PaRx code, which you get when you get your prescription pad. You put in the date and the patient's first and last initials. Check off that I'm prescribing a PaRx Canada Discovery Pass. And when you send that, then you let your client know, give them their prescription, give them their handout, give them a link to come to this spot. And so then they'll come in as a patient, they'll fill out their code, and they're going to get contacted and they're going to receive a Canada PaRx Pass. It's kind of amazing. So now, thank you for your attention and interest in nature prescribing. We hope you also enjoyed our photos from nature adventures, both in Canada's national parks and in hidden pockets of nature in Edmonton and Calgary. Thank you.
Thank you, everyone. Enjoy.